Aurelio Fernandez has been a healthcare professional for over 45 years in South Florida. He joined Memorial Hospital Miramar as Chief Executive Officer in 2007, and in 2012 he was promoted to Executive Vice President and Chief Operating Officer for Memorial Healthcare System. Aurelio was appointed President and Chief Executive Officer for Memorial Healthcare System in March 2016.
Prior to joining Memorial Healthcare System, he spent 11 years in a variety of positions with Tenet Healthcare, including Chief Executive Officer at Hialeah Hospital and Florida Medical Center, as well as Executive Director for Tenet Network Management. During the 1990s, Aurelio was Chief Executive Officer of PalmMed Health Services, specializing in physician ventures, as well as actively participating in organizing physician hospital organizations.
Aurelio is active in numerous organizations, including serving on the Board of Directors of Catholic Health Services, immediate past chair of the Florida Hospital Association, and current member of the Board of Trustees, and Safety Net Hospital Alliance of Florida, as well as a member of Broward Workshop and past chairman of the board for the South Florida Hospital and Healthcare Association. He was recognized by the Boy Scouts of America South Florida Council Citizen of the Year Broward County Award, as well as a recipient of the Silver Beaver Award. Aurelio is also a recipient of the FIU Torch Award, the highest honor given to alumni who have had a positive impact on their profession, the community, and the university. Additionally, he was inducted into the Miami-Dade College Hall of Fame for outstanding contributions to healthcare, given to extraordinary alumni who are leaders in their profession. Mr. Fernandez was appointed to serve on the Transition Advisory Committee for Health and Wellness for Governor Ron DeSantis in 2018.
Aurelio was born in Havana, Cuba, and has lived in South Florida for the past 55 years. He earned a bachelor's degree in business administration and a master's degree in health services administration from Florida International University. He is a resident of Plantation, Florida, where he lives with his wife. Mr. and Mrs. Fernandez have 4 sons who reside in Florida. He is a fellow of the American College of Healthcare Executives. ACHE of South Florida is proud to present to you the 2021 Healthcare and Community Impact Award recipient, Mr. Aurelio M. Fernandez III.
Hello, Aurelio. How are you?
Good morning. Good morning. I'm doing great.
Good, good. Happy Friday. It's a pleasure to be having this conversation with you. And thank you so much for your time. My name is Oyinkansola Bukky Ogunrinde, and I'm the president of the ACHE of South Florida for 2022. And again, it's a pleasure to be having this conversation with you as our Healthcare and Community Leader Award recipient for 2021. You've been a leader in South Florida in healthcare and also in the community. And as a board, as a chapter, we thought that we would honor you by speaking with you and just have you impart some of your knowledge, your experience, and the wisdom that you've acquired over the years with our chapter members and again with the community. So Aurelio, tell us about who Aurelio is as an individual, as a family man, and certainly as an executive healthcare leader.
Well, thank you, Bukky, for the opportunity to be here today and share my journey. It's been a wonderful journey over 45 years, and I'm so fortunate to have been able to work in the South Florida area my whole career. That in itself brings a tremendous amount of opportunities to work together and learn other institutions and other services, not just hospitals, but managed care plans, physician practices. So it started in 1976. Went to a hospital down in Hialeah called Palmetto General Hospital. My background is finance, so I went through the accounting department as the assistant controller. Eventually moved on to another hospital in 1980 to implement a computer system. At that time, this particular hospital, Pan American Hospital, did not have computers, and my job was to convert from a manual system to automated system. And that gave me a tremendous exposure in how really you capture the data that you need, not only for billing, but also for statistical purposes. Back in 1980, we did not have the quality indicators and the utilization review, processes that we have today, but it gave me that chance to understand how's the platform work to build these particular databases. From there, it was a very successful conversion where we were able to capture a significant amount of revenue that was being lost because of the manual system. And all of a sudden, I became a hero of the organization. That cemented a reputation of being able to do turnarounds. I was with that organization for 6 years, and the hospital that I was at, the organization sold it to another company, which today is Tenet Healthcare. When they sold it to Tenet Healthcare, I went with Tenet over to Northridge Medical Center as the chief operating officer, because I had a mentor, a Pan American, that said to me, Aurelio, I think you should leave accounting or finance and go into management. I suggested you go back to school and get your master's in healthcare administration. And I did. I went to Florida International University, where I had received my undergraduate degree in accounting and received my master's in health services administration. So I did Northridge for a couple of years, and then the same group that used to own Palmetto General Hospital called me back for another conversion. The organization was called PalMed, which the largest physician partnership at the time. This is 1988. And we hit another home run. And the organization became the most successful physician partnership in South Florida. We actually built a medical office building. We had the first physician hospital organization, which was a clinical integration model where physicians and hospitals come together to deliver healthcare in the marketplace. And again, it was a very, very fulfilling chapter in my career. From there, there was a very entrepreneurial person in Palm Beach that wanted to replicate what was done in PalMed. So myself and Dr. Eddie Goldman, who was the chairman of PalMed, left and helped start this company called Fine Matrix. And that lasted 2 years. The company did go public. I only lasted 2 years. There was the fundamentals of the organization did not live up to the expectations. So after 3 years of being publicly traded, or 2 years, the company went off the stock exchange. But by that time, I had come back to Tenet to organize. We had 11 hospitals at the time, to organize PA shows and consolidate them into a huge super PA show. I'm talking now 1994. And I did that for a couple of years, and we were not getting any traction. Managed care was not buying our services, and ended up telling the regional person, Don Steigman, listen, I want to go back to the hospital setting. It is much more structured. You can measure your outcomes, and we're not getting anywhere with a super PA show. And I did. I went to a hospital, Parkway Regional, that no longer is Parkway. Now it's Jackson North here in South Florida. And spent a year and a half there, and I had the opportunity to become the chief executive officer of Hialeah Hospital. Hialeah Hospital had been around since the 1950s. Tenet had acquired that hospital from the Adventist organization, and the culture there was quite unique. We were extremely successful in developing new product lines, but more importantly, to leverage the culture in that institution of caring and being sympathetic, and it was just a very, very unique experience. From there, I ended up going to another Tenet hospital, Florida Medical Center in Broward County. And I did that for turn the place around. It was very frustrating because when you work for a for-profit organization, you have to deliver quarterly earnings. And I just wasn't delivering quarterly earnings from my institution. So it was very frustrating. The neighborhood had changed. The medical staff had not attract new physicians in the area. So you were dealing with a very difficult service lines were being replicated elsewhere. So the competitive environment, the landscape was very, very tough. So I ended up coming to Memorial Healthcare System. Memorial Healthcare System is a public healthcare system, and it's called the South Broward Hospital District. We have 6 hospitals, and I became the CEO of Memorial Hospital Miramar. Did that for 4 years. And my predecessor, Frank Sacco, needed a chief operating officer. I threw my name in the hat, and I became the chief operating officer for the healthcare system. And I did that for 4 years. When he retired in 2016, I put my name in the hat to be the CEO, and they did a national search. It really didn't make sense to go outside the organization because the organizations was extremely well run, very strong financially. So I've been doing this now since 1976. My contract ends on April 30th, and I believe it's that time to retire. But my experience here at Memorial has been just nothing but one of the best chapters in my life. The things that we have accomplished, the financial strength of the organization, the level of care that is being provided, what we experienced over the last 2 years with the pandemic. Hopefully it'll never happen again, but the response to the community and how we helped each other, other hospitals and other nursing homes. And it was just an amazing collaboration of clinicians, caregivers, heroes to maintain a safe environment and not have the potential of spreading the virus to our employees. I mean, it was just a fascinating 2-year period because nobody had ever gone through this. It had been 100 years when the Spanish flu was around, and for us to experience, we were learning every day and coming together and trying whatever we needed to try was exceptional. So as you can see, it's been a great journey, a very rewarding, fulfilling journey. And I hope that I can pass the knowledge and experience to those who come behind me.
Thank you so much. And you're actually already doing that. That is quite a storied career, I must say, Aurelio, and thank you for sharing that. As you were touching on some milestones of your career, a couple of things jumped at me. And that was the advice of your mentorship, of your mentor, excuse me. You know, I was going to ask you, when did you know you wanted to become a healthcare leader? And from what I hear from you, it seems that a mentor had advised you to pursue that career. Could you speak to the importance of mentorship and particularly how that indeed, you know, changed the course of your career and led you to healthcare leadership and management, which you've clearly excelled at for a number of years?
Yeah, you're correct. If it wasn't for a mentor who advised me to get into the management track, I would not be sitting here today. You know, I've been married 47 years. My wife has raised our 4 kids, and she never worked outside the home. Obviously, she had a full-time job raising the kids. So it was on my responsibility to make sure that my compensation was adequate to maintain a family of 6. And this gentleman felt that not only was I better equipped to be a management, an operator than finance, but it also provided me with the track to generate income that was much higher. Mr. A.B. Weiner, who's the one that advised me, he was an older gentleman. He was the financial advisor for the owner of the hospital. So he had been around long enough to identify certain traits that I brought to the table that were quite unique and not necessarily financially driven. And that got me started, and that's how I got my master's degree and went into management. But when they recruited me to PalMed, the founder of Palmetto General Hospital, Dr. Elliot Berg, who was a thoracic surgeon as well as a awesome businessman, took me under his wing. And we started with a little partnership with 142 doctors, and we built it into something that made a lot of noise in South Florida. We were revolutionary. We were very, we would implement and we will execute on a lot of our ideas. And I believe that's one of the secrets of success, the ability to execute ideas. A lot of times there's a lot of talk, there's a lot of committees, and why shouldn't this happen? Because you're gonna fall, but you first need to fall and get up. And he's the one that taught me that you'd rather try something, fail, but at least you tried. And don't get into a new project until you finish the old project. Don't go 10 years out when you do not know what's going to happen in 10 years. Make your strategic initiatives closer to a reality period of time. Look what happened with COVID. Who would have thought that COVID was going to hit? And then what happened to all the plants? I can tell you that from our personal experience, a lot of our projects were put on hold. Some of our projects have never gotten off the ground because of COVID. So it could be very disruptive. And what I learned from them was that you surround yourself with people that are smarter than you are. And we have an awful lot of talent here at Memorial in the executive suite. Everyone brings to the table a level of sophistication and that just adds value to the conversation. And we tend to understand the why. Why are we embarking in this journey? Why are we going in this direction? Why should we invest in certain programs? You know, you're seeing an awful lot over the last several years going to outpatient. But, you know, how do we leverage our technology to really give the consumer what the consumer wants, which is access and convenience? And the way the traditional model works, it's very difficult to respond to the consumer in that manner. And we have the horsepower within the executive team to do so by surrounding ourselves with extremely talented executives at all levels. It's not just operations, but in technology, in nursing, in medical staff. It's quite a unique group of people. So mentoring is very important. If there's a takeaway, identify someone that you respect that can help you find your vision and learn from that individual. I would not be here today if it wasn't for those two individuals.
Oh, wow, that's incredible. Thank you. Thank you so much for that. You talked about surrounding yourself with a team of very competent individuals. And that is an attribute of leadership that I think it's still underestimated. Tell us about being a leader and how you facilitate followership, or how you cultivate a team around you to bring their best selves to the table.
Yeah. Well, you know, one of the things that has happened over the 6 years that I've been in this role is that there has been turnover, in the sense there's a lot of the folks that were here before retired. This was a organization that had a lot of legacy. A lot of the executives have been here for many, many years, but then they hit that age where they say, you know, I need to move on and do something for myself. So on several of our positions, you always want to hire from within, but I felt that a new set of eyes and a new, someone energized in a different manner was more important. So I did bring in people from the outside that provided that executive team a perspective, not just from Memorial, but where they came from. So I did that with the Children's Hospital. I did that with Regional Hospital, which is our flagship hospital. I did that with the Chief Medical Officer, because those individuals that were in those roles had been there forever. And a new set of eyes always re-energizes the team. And I believe deep in my heart that this new team has re-energized the enterprise to the extent that it's in a growth mode. I did the same thing with our IT department. And how do we leverage the platform that we have and elevate it to what it can be done, especially moving forward, and how you're going to leverage technology and delivering healthcare. I know that maybe there was opportunities in other areas that internal promotions were appropriate, and I went that route. So it's a function of the size or the scope of work and where is it that you want to take that particular division to. One of the things that we have done, Bukky, is we have reorganized over the last year, and we are having our service lines drive the business, not the hospitals. The hospitals are there to support the service lines. What has happened is, let's say you take cardiology or cancer or neurosciences, and it was not delivered the same way at one hospital as the other. Well, cardiology should be delivered in the same standardized, whether it's at Regional Hospital or Memorial Hospital West or wherever. The hospitals are there to support the service lines. So we have had a change in the approach that the organization drives our 6 or 7 main service lines. And hopefully, not hopefully, I know for a fact that we are making progress. We have assigned a vice president for each one of the service lines. We have a senior vice president that now oversees all the service lines so that there is accountability in delivering the type of not only care, but how do we provide access to the consumer? The consumer does not want to wait 2 weeks, 3 weeks, a month, 2 months. They want to see that provider the next day or the day after. And not unless you have a smooth running enterprise can you deliver that type of expectation. The consumer now has a lot of options. Back when I started, the physician said, you're going to go and see this specialist and you're going to go to this hospital. The consumer today say, no. Let me look it up. Let me see the physician that you're proposing that I go see. Let me see the outcomes of this particular institution or outpatient clinic, and I will make that decision. It's my body. And this is a total change from what it was 30 years ago, 20 years ago. And we need to be cognizant that the consumer out there is an educated consumer. They have access through a variety of ways to evaluate whether or not that level of care is the right level that I expect. So I think leadership, allowing people to do what they know best, because a lot of times we think we know it all, and you have to let people on their own. And like the advice that I was given, if you fail, you fail, but at least you tried. If you do not try, you never know if you're going to be successful. And for the most part, if you have a collaborative team that help each other, most times you succeed. We've had very few failures in this organization.
Thank you, Aurelio. First of all, I love what you said about, embracing failure, right? That's not the goal. That's never the intention, but understanding that that's a risk of taking on any task and kind of going for it, obviously, by managing the risk or the impact to others, especially to our consumers. And you did talk about our consumers being much more informed, having more information at their fingertips, right? And they bring that to their providers to challenge them, even word of mouth, hearing from their neighbors and everybody else. They bring all of that information to you as a way to continue to challenge the care that they're getting. And therefore, just providing care is no longer the competitive advantage. It's that next level. As you think about serving patients in this new paradigm, right? What are the skill set that a leader leading an organization must have to be able to connect with the consumers, to connect with the patients, to bring about patient satisfaction by way of quality care delivery? What are those things that a leader really just needs to have, or maybe team members and the IT infrastructure that, again, they need to have to be able to connect effectively with the consumers and with patients?
Good question. And you have to be flexible. What worked just 5 years ago doesn't apply. The playbook that we used 5 years ago does not apply in the new paradigm that you're referring to. We need to leverage technology. The virtual access to virtual healthcare has just gone through the roof, and every provider knows that. We have gone from approximately 500 virtual visits pre-COVID to over 10,000 a month virtual consultations. And it's not just the consumer that needs to adapt, the provider needs to adapt. It was very challenging for us to have our physicians feel comfortable assessing a patient and evaluating the conditions of a patient virtually, because they're not touching, they're not having the stethoscope, they're not having the tools that they have when they did not depend on technology. So having the flexibility to adjust to a new environment, I think, is an imperative. If anybody thinks that we're going to be like in the old days, it ain't going to happen. It's going to be a real challenge. So the flexibilities are utmost important. I believe that creating the infrastructure to support the leveraging of your technology platform and capitalize on what's available out there. You know, when you have, and we all buy software from everybody, we tend not to utilize everything that's available out there because we do not know. So we might use 50% of the available programs that are out there. Have we educated the staff to learn how to maximize documentation, you know, drug interaction, all the things that we depend on the computers for helping us deliver the care that we want to deliver. Sometimes we do not maximize the full potential of that software. We need to spend time with the users of that software as to what would you like to see? What is it that can make your job easier? And then you go back to the third party who's providing you that technology and say, do you have this? And I would venture to say that 90% of the times they have it. We just didn't know about it. Then you have to educate the user and say, you know, Physician Fernandez, if you order this and there's going to be a flag that's going to come up, and if you feel it's appropriate, you should order it or you should cancel the order, whatever it might be. But let the tools that are available to you help you navigate through the care of that patient, because we all know that it's getting more and more complex. It is extremely, extremely complicated, the way we deliver healthcare. And the quality expectations that are out there is just huge. It upsets me that the consumer assumes that everybody's safe. I can tell you that they're safe. There are some hospitals that are safer than others. And, you know, we're very proud of the fact that pre-COVID, all of our hospitals were A hospitals according to Leapfrog. We were the recipients of the American Hospital Association's, our finalists in the American Hospital Association Quest for Quality Award. These are all quality indicators. We have 3-star ratings in the Society for Thoracic Surgery for CABG, valve repairs, and valve replacement. Nobody else has those credentials here, which is a clear indication that the commitment and the investment that we've made on safety and quality is being noticed by third parties that are totally independent from the organization. But the consumer doesn't know that. It's like you getting on a plane and assuming that everybody flies. Yeah, but you have a different experience when you fly one airline compared to the other. In healthcare, the consumer hasn't gotten to that comparative environment unless you're an educated consumer. But as I said earlier, through the inquiries that the consumer now can make through a variety of ways, facilitates the ability to assess where they would go and not go. And I can tell you it works because when I used to be at the hospital setting, I would make rounds and I would visit patients. And why did you choose our hospital? It says, because I looked it up and you had a better rating than the competition. And that was years ago. I haven't been in a hospital as a operator for many, many years. So now it's even much more accessible to the consumers. You can imagine, I really suggest that we take seriously the delivery of healthcare in a safe environment, because that data is being captured and the consumer is looking at it. That's the new paradigm I see.
Oh, that's quite introspective, because as I hear you talk about the power that consumers have, especially pre-COVID, right? And then during COVID, there are some changes that had to take place where perhaps even getting those accreditation at that point in time was not the priority. We just have to deliver care and save lives. So as you reflect on that, dealing with the consumer, the public, and COVID, can you speak to the lessons learned from that? because again, we're putting the wheels on the car as it's moving, right? And it wasn't business as usual, even though quality of care had to be maintained, but there's a different priority of just saving lives. Yeah. How did you deal with the period of COVID in the context that you just described? Yeah. And what lessons did you learn from that informs how healthcare will be delivered in the future? Yeah, well, I can tell you that caregivers have resilience. What we experienced over the last 2 years is nothing but remarkable, and we call them heroes, because the frontline staff and even the background folks understood that this was no longer an 8-hour job or a 12-hour job. This was around the clock job. What I learned was that we met every day. We evaluated the levels of PPEs that we have to make sure that our staff had adequate PPEs so that they would not feel threatened by the virus. We provided a variety of options to the employee, like off-site living so they wouldn't go back home. We provided them with every possible piece of equipment to make sure that our patients had adequate respirators and ventilators, and you name it. Money became secondary. Our board of commissioners were extremely supportive to provide us with the means to do whatever it takes to have the staff, give the staff the resources necessary. When the nursing shortage came about in 21, they provided us with the flexibility of bringing in travelers, which became a very expensive option. But no one in this organization was laid off. We never cut the salaries. Everyone had the right to get their annual evaluation. That gave the confidence to the staff that we were looking after their well-being, as well as giving them the tools and the resources to deliver healthcare. That had never happened before. Daily meetings, buying supplies internationally because the local market didn't have the level of supplies that were necessary. Going out and bringing nurses from all over the United States because we did not have adequate staffing here. And 21 was real radical. The Delta variant really had a huge impact. We were very fortunate to be one of the 5 healthcare systems in the state of Florida to receive the Pfizer vaccine in December of 2020. And at that time, healthcare givers were the ones that had priority, as well as nursing homes. So we led the market in that way. And I quite honestly feel that the reason we were given the first round of vaccines is because the governor knew the type of care that was being provided and the safe environment that we had. For the first time in my 40 some odd years of working in this industry, I never had experienced the collaboration between hospitals. You know, we're all very competitive in nature, but when it came to this pandemic, all of us, without exception, worked together to make sure that the community was safe, that the nursing homes had the adequate supplies and resources, because the nursing home was a good barometer, because we would see, if you see a lot of traffic going into the emergency room from nursing home A, you knew you have a problem there. So we will deploy personnel to that nursing home, say, what's going on here? And that had never happened. If a hospital needed something, we would call each other, even on the weekends, to see, hey, can I spare some PPEs? I'm not able to find enough N95s or whatever it was. And it wasn't like we were giving it away, but we would lend them the supplies, and then we will get them back. The vaccines, we knew that we should not be the only ones with the vaccines, and we distributed to the other 4 healthcare systems in the area, Broward Health, HCA, Holy Cross, and Cleveland Clinic, because it was the right thing to do. It was the right thing to do for the employees in those institutions. And we continue to stay in touch every time there's a surge. You know, there was a surge this year in January. Fortunately, it was not like the Delta variant, but we will again have conference calls every week. We had the department, the Agency for Healthcare Administration out of Tallahassee participate,
And we led the state of Florida as far as setting programs to keep a community safe. And, you know, the first time around, South Florida, Dade, Broward, and Palm Beach has about 30% of the population in the state of Florida. But we had 51% of all the COVID patients in the summer of 2020. And we brought that under control, that when Delta hit, we were not even close to 50%. There were other hotspots like Jacksonville, the Tampa Bay area. We had gone through that, but the fact that we collaborated between providers really set the tone for the whole state of Florida to embrace that concept and keep the community as safe as possible. Don't forget, in 2020, we had an invisible enemy. We didn't have any weapons. The weapons we had was wearing a mask, wash your hands, and keep social distancing. The vaccine didn't come out until December of 2020. Now that you have the vaccine, it was very discouraging to see that those who were in the ICU in 21 were not vaccinated, knowing that the vaccine worked for whatever reasons. And I'm not going to get into the political aspect or ideology aspect, but there was a fact. We did not have patients in our critical care units that were vaccinated, only those. And unfortunately, a very high percentage never made it out to the hospital. So huge lessons learned. Follow the science, provide the resources you need for the staff. They will deliver. The staff will deliver. It's just an amazing team. Once you get into the field of caring for patients, you're there for a reason, and the reason is to save lives. And it is proof is right what has happened over the last 2 years.
Thank you. Thank you for sharing that incredible story and insight. And as you were speaking, the terms that were coming to me was not just collaboration, which is very obvious here, but really the community impact, right? The bigger community impact beyond the patients that you serve specifically. And of course, from reading your bio, I know you're also very involved in the community by way of sitting on different boards, Boy Scouts of America, we could go on and on. Could you speak to why that is important to you? Why is it important to serve the community beyond your desk, your executive desk at a hospital or provider setting?
Yeah, that's a very good question. Hospitals in itself are critical component of the culture of any community. When you are looking at moving your family, you look at two things: education and hospitalization. What kind of networks you have. I belong to a group called Broward Workshop, which is 100 leaders in Broward County, and we get engaged and we get involved to see what's right and what's wrong. I can tell you that gave me the exposure to present status to the business community. I would speak in the League of Cities. Broward County has like 30 municipalities, and I would tell them as it is. I did not hold back. Even though it was not popular, to tell the story that was going on, because businesses were losing money. And I kept emphasizing the need to have the consumer wear masks. This is pre-vaccine. Then the Broward delegation, which is all the elected officials, both state and federal elected officials, and tell their story. And what is it that we're doing as a healthcare system? We are a safety net hospital. And a safety net hospital, there's two in Broward County, ourselves and Broward Health. We're to care for patients regardless of the ability to pay. And if we do not tell the story, we could be inundated with patients that might not really need healthcare. Let me share this, what happened during the pandemic. The level of emergency room traffic went down like 25% during the pandemic. And what that tells me is that the consumer was using the emergency room, not because it was an emergency, but just because they wanted to use the emergency room. In the pediatric space, it went down over 50% because kids, remember, they were out of school in 2020. And all of a sudden they didn't interact with other kids, and therefore they didn't. We're back to normal now, by the way. So it's taken about a year plus to get the emergency traffic back to what it used to be. So telling those stories was very important. And you know, what I got out of it was that they would thank me, not to sugarcoat the problem, but to let them know what the potential damage it could create to the community if everyone got infected. Now, you would venture to say that about 10% of the residents of Broward County did get COVID positive. Thank God that not all of them got the need to be admitted, but they could stay at home and quarantine at home. And as we got smarter and knew the illness, it went from 2 weeks, because I was COVID positive in 2020 at the beginning, and I was quarantined for 14 days. Now it's down below 10. This is a weaker variant. All these lessons learned. But if you were not out in the community, we would not have been able to tell the story. And the colleges, you would speak in all the chambers. And even though it was virtual during the pandemic, at least the business community and those members knew what was going on. It's very important to be engaged in United Way, March of Dimes, the Heart Association, the Diabetes Association. We belong to all of these associations to make sure that we have representation there and see what else that we can do for these particular associations. And I think it's an imperative, whoever sits in the corner office, to be out in the community and be very active in events. And you know, a lot of times there are evening events, there are dinner events, but you have to do it. It comes with a job description.
Thank you. Thank you for sharing that, and again, emphasizing the importance of being in the community. And that's why I know the ACHE award, it's about community impact, not just healthcare. And I think you speak to that eloquently. I think this is a good time to segue into your service, even on at a community level, but even at a broader capacity. I believe you serve on the Transition Advisory Committee for Health and Wellness for the governor in 2018. And as you were telling your story, you did mention the difference in the volume that you saw in the ED, which informs us about where individuals are receiving their care, perhaps why they're coming to the ED in the first place. And I think underscores the need to address health and wellness. And speaking of which, wellness is actually one of the themes for the ACHE of South Florida this year. Could you speak to that endeavor, please? And why you think health and wellness is the key to sustainable communities, right? And really a part of the future of healthcare as we see it, including that hospital at home or ambulatory care delivery as an adjunct.
Yeah, we keep hearing social determinants, and that is key to keeping somebody healthy. And you should be starting to see more and more resources putting in this area to identify what's really going on with that individual that needs to frequent the emergency room. We have a program in conjunction with the Salvation Army where we call them frequent flyers who present in the ED. And we have beds with the Salvation Army that we help underwrite to have that individual a place where they can sleep and bathe and so forth. And many of the traffic that we had in the emergency room really was to eat, and it was really not the appropriate venue for someone to come in. We need to work on identifying those issues early on, and what are the solutions. And it's not really the function of the hospital, but it is part of the hospital too, because you're going to see a lot of inappropriate utilization. Broward County, we're very fortunate in Broward County to have very active programs with the United Way, with the business community, to provide options to those who are less fortunate, and in housing, in transportation, in delivery of healthcare. The fact that we have two healthcare systems here that provide a safety environment is advantageous. Not every county has what we have here in Broward County. And I think it's important. It's a social requirement, in my opinion, a duty for us to be responsive to what are the needs of the residents of Broward County. One of the things that also we learned during the pandemic was that folks were not calling 911 because they were afraid of getting COVID. And I can tell you that the number of 911 deaths, what happens is 911 measures response and how many expire, doubled in the city of Hollywood, which meant that people were waiting too long to call 911 because they were concerned about COVID. In women's health, we saw a huge decline in the number of women having their mammography studies done. And what that does, it prolongs the exam, and it could cause more damage in the long run. So having a law or having individuals avoid the testing and the procedures has caused an increase in the number of critical level of care that is being provided. Heart disease, definitely cancer. Cancer is the one that comes to mind because folks were not leaving their homes, and that was very, very disturbing. These are lessons learned. And, you know, how do we do? And one way to avoid, you cannot have a remote or a virtual mammography test. You have to come into the site. You can have a virtual EKG or checking your lungs because the technology that's out there allows us to do it. But there's certain things you have to see the physician, and that was not happening. And as I said earlier, the traffic in the emergency room in the adult space went down like 24–25%, which is an indication that those individuals were not really of an emergent nature. I believe that these lessons, if there's another surge, because the variant is going to be more severe, have already been factored into the equation. The fact that now we have the booster shots, and now they're talking about a fourth booster shot. This is going to be with us for forever now, by the way. This is going to be like you take the flu shot every year, you're going to take the COVID shot every year. The fact that people are not using masks anymore, you know, it's an indication that they feel good about it, especially if you've received your vaccine. You can go out there and live a normal life. But the last 2 years have been extremely difficult, a lot of lessons learned, and we will need to adjust and be flexible to the new wave of how healthcare is being delivered and how you as an executive motivate your staff to respond to the consumer needs in such a way that you have access, immediate access.
Well, thank you. Thank you so much again for that gem, that leadership gem. And I do agree with you. The way we do business will no longer be how it used to be. We really just have to be always prepared, as you mentioned, and be adaptable and flexible in the case that we do see something else or new, because you think you've seen it all until something else shows up, right?
Yes.
So thank you for that insight. I do want to pivot a little bit to ACHE. You've been a member, I think, since 2007. You are a fellow of the college. Could you please tell us how ACHE has impacted your career or enhanced it and shaped it or facilitated it?
Well, you know, what it does is it gives you the vehicle to network with your colleagues and create relationships that are so important. Here in the local chapter, as you know, every month there's a meeting and people congregate. Every year we host at least one of the meetings. I've spoken to tell the journey because there's got to be a reality check as well. You know, a lot of us professionals that go to school, get a master's degree, and automatically think I'm going to be the CEO of a hospital. Well, it doesn't work that way. Here in South Florida, we have 53 hospitals. So there's only 53 jobs out of 6.5 million people in South Florida. But we need to be aware that having these credentials helps us getting in the door. We emphasize being a fellow in the ACHE in the American College, and every CEO, myself, my chief operating officer, my chief financial officer, the CEOs at the hospitals, and if they're not, we give them a period of time that they have to become a member. It's just something that you put after your name. And it doesn't happen in every organization, by the way, but it creates that expectation that if you're going to work at Memorial Healthcare System, we expect for you to be a fellow. We have had a couple of employees that have been the chapter presidents, for Broward County. And that's how we are engaged. In my personal, when I started out, I used it to network. Go to the annual conference in Chicago. I mean, I really leveraged that. And now at my stage is a different approach. But at the early stages, I thought it was very helpful and continues to be. Those who are recent fellows and members of ACHE find it that interacting and how's your system doing this? How are you handling the other emergencies? So it's a way to communicate. It is a way to evaluate. Should I go in this direction, that direction? But like everything else, if you do not put in the time, you're not going to get anything out of it. You have to be involved. You have to participate, and that's what's going to get you into a new way to see things and perspectives. So that's, at least from my way of doing these things, is communications, getting involved, learning how others do it, and see if I can adapt any of the recommendations to fit our culture and our mission.
Thank you. Thank you so much for sharing that, Aurelio. I started out asking how ACHE has really helped your career, but I do also want to say that thank you for the impact that you've had on ACHE. Again, while we're honoring you, and we really do appreciate that. So I do want to ask you about the challenges, right, of your career. As you mentioned, we go into this, we pursue our degrees and we think, oh, you're going to be CEO. It's going to be a straight line, not an issue, but we know it's never a straight line. And sometimes we do get with that dose of reality. As you look back at your storied career, do you have any regrets at all? Or maybe something that you would have done differently?
No, listen, I've been very fortunate. I've worked for great organizations, great individuals. And like I said, I had a couple of challenges that really I could not overcome. What happens is you need to adjust. You need to be fair. Integrity is utmost important. The day that you're perceived in the market as someone who does whatever it takes to get to the top, you're not going to be successful, because people know the type of character you are. So being performing in such a way that you have the interest of the organization first, not your individual interests, it's of utmost importance. If I look back in my career, I've been very lucky. I found my first job by coincidence. I never, in my undergraduate degree, thought about going into healthcare. It just happens I needed a job. And there was an opening at Palmetto General Hospital in 1976 in the accounting department. And from there, you prove yourself, you work hard, nothing is going to be given to you for free. It is hard work. Anyone who thinks that it's 8-to-5 job, you're not going to make it. You got to put in the time, and you have to really embrace the culture of the organization and the mission that you're under. So as far as what would have done differently, that's in my DNA. And I believe it works. I have never seen someone who has integrity, works hard, and puts the organization first fail. I've never seen it. So you have to do something you have to be really grossly negligent in doing something before you can be adversely impacted. But if you work hard, you have integrity, and you put the organization first, it is the formula for success. So no, to answer your question, I don't regret anything I've done. The 2 engagements that I did not do well were lessons learned. And you go from there. And I've bounced back, and I've gotten into better situations.
Oh, thank you. Thank you for that insight. I love it when you look at challenges or even failures, if you will, as lessons learned, rather than something that impacts you adversely moving forward. So incredible reflection there. Are there any books or a book in particular that you would recommend that leaders, healthcare leaders, read? Something that maybe you read that helped you?
Bukky, I don't read that many books, but I do read a lot of journals. From the book by From Good to Great was an eye-opener to me, that says the story of how great companies operate. And I had the pleasure of meeting Jim, the author, Jim Collins, on a private jet flight from Florida to California. So I spent a good 4 hours in the air with him, and very interesting fellow. And he gave me a lot of insight and confirmed what the book was saying. Is as long as you put a quality product out and you're responsive to the consumer, you have the infrastructure to support the business that you're in, it's formula for success. So I unfortunately do not read a lot of books, but I do read a lot of magazines. And the last book that I read was Obama's Journey. So that was quite a while ago. So that was a few years back.
Well, first of all, you've been quite busy, of course, like a couple of years, right? And of course, magazines are books too. As you know, all the information that we use as healthcare professionals come by way of our magazines, our journals. So plenty of information there for us to absorb, and perhaps less time for other fun books. But I'm sure you probably will have time to read more books now that you are retiring.
Yes.
And I do want to end on that lighter note. Is, what are your plans for retirement? And before you talk about that, your bow tie. I talked to you earlier about it, and you said you had a story. We want to hear the story. Give us the story behind the bow tie, and
Sure.
let us know what you'll be doing as you go into retirement.
Sure. Well, back in the 90s, there was a fad in the executive suites of casual Friday, and people were not wearing ties. And I'm a tie guy. I have to wear a tie, otherwise I feel naked. It's like a uniform for work. I had to wear a suit and a tie. In any event, I just couldn't come down not to wearing a tie on a Friday. And I had always worn a tie maybe once or twice a month. And I said, well, why don't I wear a bow tie every Friday? This is 1999. And there was a gentleman that I was working with in one of our hospitals who was significantly bigger than I am. I'm short. So I'm 5'5", and this gentleman must have been 6'3", 300 pounds. And one day he shows up with a bow tie, and I show up with a bow tie. And I said, Peter, why don't we do this? I'll wear it every Friday, and you can wear it any other day of the week. So that stuck. That was 1999, and I've been wearing a bow tie every Friday since then. So it's like a signature thing. Some people, use it as a logo in certain events just to relate to it. In any event, that's the history of the bow tie. What am I going to do when I retire? I don't have any plans except spend time with my wife. As I said, I've been married 47 years. My children are old, they're in their 40s and 30s. So we're going to take some time to spend it together. We had, I have a very supportive wife who understood that I needed to go out to work. So she wasn't one of those that says, you're always working, you don't spend time at home. She understood what it took to be successful. And for that, I'm grateful. And now it's time to spend time, hopefully stay married, because she's got to get used to me being at home. But I'm sure we can work those things out. Do a little bit of traveling. I'm not someone that's going to say I'm going to travel from now on, but I'm going to spend time with I have 4 grandkids. One of my sons lost his wife recently and left behind 2 young kids. And we're going to spend a lot of time with them and help them grow up. And that's my plan. And again, I've accomplished just about anything I set out to accomplish. But there comes a point in time in everyone's life that you say, you know what, it's time to hang it up. It's no longer money. It is, I don't need to prove anything else to anyone else. And let somebody else take the baton. There's a lot of competent and capable people out there that can re-energize this organization and take it to the next level. So that's what I'm going to do, Bukky.
Wow, sounds like quite a lot there. Now you said, you weren't quite sure, but it's just, again, thank you. Thank you for your career. This has truly been enlightening and impactful for me. I certainly didn't know a couple of things about you, and it's just really cool to learn about them. And that is what we hope this legacy series will do for our members, and even those who are not members, just to hear from a healthcare leader and really connect with you on those the things that you've shared, and hopefully become better leaders themselves, because we need more of you. That's for sure. And again, thank you so much. I do look forward to May 12th, where we get to present to you with our Healthcare and Community Impact Award. And that's going to be at our inaugural chapter recognition, appreciation and recognition event. So again, we're so grateful that you're part of our chapter, you're part of ACHE, you're part of this community, and we thank you for everything you've done for healthcare. Thank you, Aurelio.
No, thank you for the opportunity. Really appreciate it.